London. Um, we have the pleasure today to have a spectacular joint with Makeover Monday and Operation Fistula. And what we're going to be doing, it's something unique. It's the first time that we have a virtual London talk. And thanks everyone for joining, wherever you are around the world, here in London, somewhere else. Tableau user group, we are 5 co-leaders. We are your hosts, Paul Chapman, Laura Sanford, Sarah Bartlett, David Pierce, and myself. We've been doing this for quite a long time now. And we welcome you to our user group. For those who are interested, the applications for speakers to the Tableau, to European Tableau conference are closing next Friday. So don't forget to apply. Here's your link, and it'll be great to have as many applications as we can for the conference. This is a virtual Tableau user group. So we can, if you want to say hi, please use the Q&A button here on Zoom, or if you have any questions for the panel, feel free to type your questions there. We are going to help answering them, all of them. Without further ado, I would like to introduce you to Seth and Helen from Operation Fistula, and thank you very much for being here with us.
Hi, everyone. I'm just going to share. I don't think I can share my screen yet.
Just give me a second. There you go.
Fantastic.
Technology.
Brave new world of virtual meetings.
Perfect.
Fantastic. So.
All right. So we are so excited to be here at the Tableau user group. Obviously a little disappointed that we're not in person, but I think we all are going to have to get used to doing these kind of meetings. So let's see what we can do with this virtual space. We're going to tell you a little bit about our program, Visualize Gender Equality. Before we start though, if you haven't had a chance to go and register at viz5.org, this is just putting your name in, saying that you're going to follow what we're doing. We might send you a couple emails, but we are trying to get somebody from every country in the world, and we're now up to 47 countries. So, and almost 600 people. So if you haven't signed up, please go to viz5.org and just put in your name. We'd really appreciate it in this global effort that we're trying to drive. We're going to tell you a lot more about this program, and we're going to get your input, hopefully, if we can do it here. So.
But we thought we'd start up. We thought we'd start up with a quick warm-up exercise. So I think if the tech works, you guys should be getting some questions popping up soon, inquiring about where you're calling in from. Look at that, it worked! Amazing. So we're hoping you guys can let us know where we have folks from who are joining us today.
And we couldn't list every country on this list of options, but I can see the attendee list, and I can see people from, well, there's New Orleans, there's Boston. It's great to see a bunch of familiar names from the Makeover Monday community. So let us know where you're dialing in from.
And that's just like Pablo was saying, that's the silver lining, right, of this virtual event, is that we're not here in person in London, so we have people from all over the world joining us. So welcome.
Can I just say thank you to the 2 people who already signed up at viz5.org. That's viz5.org. So that's pretty cool. Pretty quick response.
We're live watching. We're live watching your names coming in here. So keep going. Keep up the good work. So now do we get to see the answers coming through? Oh, I see something flashing at me, I think. There it is. Fantastic. Oh, wow. So we have 56% of you are calling in from England.
And 30% from outside of Europe. That's pretty awesome.
Yeah.
We're global here. London Tableau user group global.
Love it.
Yeah, and 16% for the rest of Europe. So welcome. We're super excited that you're here. I'm going to skip on to the next slide now. So I don't know if you guys saw, but we put out a tweet right before the user group got started, getting folks to input on what they felt gender equality means to you, what it means to you, and what it means to the people who are part of the Viz5 community. We haven't had any answers yet, so do go onto Twitter and pop some answers in there in reply to the Op Fistula tweet. What you're seeing right now, though, is from when we initially presented the Viz5 work to the Tableau community in Seattle at the Global Sales Kickoff. And we were able to use like a live polling tool. And this word cloud is a representation of all of the things that people kind of threw onto the screen in terms of what gender equality means to people. So yeah, it's just a great way of sort of starting to think about the conversation. Eva, do you have anything to add?
Apart from hello everyone, and yeah, excited to have everyone dialed in and joining us. I think this is a great initiative. We've had a lot of activity this week, and mainly it's because it is such an important topic that is very close to our hearts, but also because it does need more conversation than just me sending out a couple of tweets in a data set. So we want to make sure that everyone is equipped for these monthly challenges, but also has the chance to really become part of the conversation. And that's why we're doing this. And yeah, it's really, really cool to be able to talk to all of you. And hopefully through the chat and the Q&A, we get a bit of two-way traffic and you can engage with us throughout this session as well.
Absolutely. So this that you're seeing now is the definition of gender equality that has really inspired us and in the Viz5 work. So I know that it's not the fashion to read your slides, but I'm going to read them. Yeah, we're going to do it because we're dare to be different. So gender equality entails the concept that all human beings are free to develop their personal abilities and make choices without the limitations set by stereotypes, rigid gender roles, and prejudices. Gender equality means that the different behaviors, aspirations, and needs of women and men are considered, valued, and favored equally. It does not mean that women and men have to become the same, but that their rights, responsibilities, and opportunities will not depend on whether they are born male or female. And that's taken from an article by Tobin and Aguilar, 2007, which you guys can check out on Google if you're interested.
So the key thing here is, and it's strangely like political all of a sudden, gender equality. We did some ads on Facebook and they got like blocked because of political advertising during the election. Who knew? Well, all this is really saying is that people should be allowed to be themselves and their best selves without any limitations that are set externally, that are based on things that none of us can control regarding gender and how we perceive our own gender. So it's not about, it's not about equality, it's about equal opportunity. It's about having the ability to be who you are. And I think what's just essential in this is that, unfortunately, around the world, there's cultural issues, there's a variety of factors that drive inequalities and inequities that are based on things that no one can control. And so at the core of this project, we're trying to shine a light on those, and in many cases, the most extreme versions. So anyone who participated in this week's Makeover Monday would have seen some pretty disturbing data about how people perceive the justification for different types of domestic abuse. And this wasn't a global data set, but it was a really extreme form of inequality. So a lot of, like, while the effort is focused on trying to realize gender equality, we're doing that by visualizing the inequality. And not just visualizing, but trying to build things that can move the needle, that can change the way that people who are policymakers or influential peoples in nations or subnational areas can really change how the system works. We know that visualization has incredible power to take the abstract and make it really concrete and give people something that they can really latch onto in order to drive these changes. And with the Tableau community, there's so many talented people who are so helpful to each other using a tool that just has incredible leverage, that we believe that the data that exists out there can make more clear where these inequalities are most pervasive, even if it's in understanding where the data is missing, which is one of the themes of this week's. So, sorry, I'm a little bit on my soapbox, but there's no audience to see that you guys are bored with me talking. So,
I'm going to go to the next slide. The next slide is technically an introduction. We've kind of introduced ourselves already, but as you see, I'm not there. So I'm Helen. I'm Helen Davies. I'm the Chief of Staff here at Operation Fistula. But I'm going to hand over to Eva now to introduce herself formally to everybody out there.
Yes, yes, and I hope that it's quite recognizable between the picture and my live video that I do look the same as in the picture. So hello again, everyone, and a few people have joined since we started off. For those who don't know me, my name is Eva Murray. I lead Makeover Monday, and I'm head of BI and Tableau-Master at XSL, based here out of London, and very much love working with the team at Operation Fistula. We've had so many good sessions in the last few months, getting this initiative off the ground, but also discussing what we can do together. And that's partly, well, that's part of why we're all here today.
Absolutely. And I'm Seth, and I do look different because I grew a beard, mostly because I don't like this picture of myself. But let's put that aside. I'm the founder and CEO of Operation Fistula. Before I started the organization 12 years ago, I used to be a data scientist before people called them data scientists. I studied operations research, applied probability, and linear programming in the College of Engineering. And so as we started to work in our, I think we're going to talk a little bit more about this down the road a little bit, but as we started to work on how to make our work in Operation Fistula work better, data is just fundamental to everything we do. And so I have loved getting to know the Tableau community, and I happen to believe that the community is maybe even more powerful than the tool itself. So I'm just so happy to be here and to have everyone here listening to our story and giving us the chance to tell it.
Fantastic. So now we're going to introduce you to Makeover Monday, our critical, incredible, amazing partner in this work, who has really transformed our ability to share this with the world. So off you go, Eva.
Yes, so maybe now is a good time for our second poll of, have you participated in Makeover Monday this week? Yes, no, not yet, but I will, maybe today. Never heard of Makeover Monday. So we'll give you a few seconds, and while you make that selection, I'm going to start. So Makeover Monday is a social data project. And typically in these kind of presentations where we have a Tableau user group, where we do a Makeover Monday live, we tell you all about the benefits of participating. But given that this is online, we thought we'll change the format a bit and we'll focus more on the actual process. So Makeover Monday is all run virtually, mainly through Twitter and the Data.World platform where we host the data. And our mission is to improve the way we visualize and analyze data one chart at a time. So every Sunday, we publish a data set and a typically poor visualization on Data.World and ask people to then create a makeover. Now, can we switch to the results for 1 second? Ta-da. Okay, so there's maybe one person who hasn't heard of Makeover Monday, so this section is for you, but quite a few people have participated, some have not, but there are a few people, well, almost half the team here on the chat or on the webinar, WebEx, Zoom, sorry, they will. So that's really great to see.
There's still time, guys. There's still time, 42%. We need you. We need you.
Also, maybe they were waiting for today to see how to actually approach the data because, yeah, there is a few things to consider, I guess. Okay, so we can close that poll. And so we've published the data on a Sunday, and then we see most of the activity on Monday and Tuesday, except for Michelle Freeman, who is always one of our first to publish. She's on this call, and I know that she typically pumps out her makeovers on a Sunday. And then every Wednesday, we give feedback, and we being Charlie Hutchison and me, who co-host this together, we have a webinar for feedback that we host on Bright Talk, and that is because we want to make sure you get proper feedback. I cannot physically or time-wise provide feedback to every tweet, write a response, and 280 characters is not enough to sensibly or constructively provide feedback on the good things and maybe what could be improved or changed. So that's what the webinar is for, because we can go through your visualizations, we look at them, we say, well, this is kind of how it the first impression we get, and then make some suggestions for changes. But also sometimes I just download a viz and do a makeover of that viz, or make some changes just to show we don't expect you to then spend 2 hours changing things, but rather it could be 5 minutes, maybe 10 minutes max of cosmetic changes to change things. And then people implement that feedback to whatever level they're comfortable with. And every Friday we publish a weekly favorites blog, which highlights the visualizations that we think that week most effectively convey the message in the data. And then behind the scenes on Saturday, we prepare the next release. So it goes round and round every week. And we have done social impact topics in the past. This is the first time we're engaging and committing to a longer collaboration, and that's going to be a 12-month collaboration with the team at Operation Fistula, who are handling the data selection part of it. So we looked at some topics. They are finding the data sets because their expertise is around gender equality. And then we're working together to make sure, okay, it's all ready to go. We provide a lot more background information than we typically would for a Makeover Monday, because there might not actually be the information out there in the public eye, or it mightn't be as easily digestible. So we want to make sure you're fully equipped for these data sets. And then basically we have, so once a month for the next 12 months, we're going to have a gender equality topic. For the other weeks, we pick random other topics, because we still want to create that space where people can practice and experiment without every week being a really heavy topic. But we did say Makeover Monday is an excellent platform. We have, over the years, had thousands of participants. We had many, many thousands of visualizations. So we want to use that platform, use all of you as a crowdsourcing to really visualize these topics, bring them to life, drive the conversations, because many of the charities that are in this area, they might have one person, if that, who works with data. So when we bring hundreds of people for each of these monthly challenges, it gives us a great opportunity to really highlight those topics and then drive some impact. And I will let Seth actually cover a bit more, Seth and Helen, how your visualizations can make a difference.
Oh, awesome. Okay, so what I'm going to tell you a little bit about Operation Fistula, and try to give you some understanding of how we came up with all this. And for me to tell you about Operation Fistula, I have to tell you about obstetric fistula, which I wish we had a poll question of who's ever heard of that before, because I bet you there's not that many people who've heard of it. It's essentially a childbirth injury that happens to women who need a C-section but don't get a good one in time. So what happens is, if there's any obstruction, the baby gets trapped in the birth canal, the pressure from that attempted delivery compresses the soft tissue and essentially the tissue dies, and it creates a hole, an unnatural connection, or a fistula. That's what fistula means, unnatural connection, between the bladder and the birth canal, or the rectum and the birth canal. And this woman will then leak waste, having no idea why, and it just has, besides having just lost a baby, because the baby almost always dies, 8 out of 10 times dies, the woman is then left leaking and confused, and then gets abused by her social network, her partner first, who thinks that it could be some infidelity, or she's diseased, or she's cheated on him or something. Then the mother-in-law will get involved in many cases. The women just get really poorly treated. And I would usually tell a story of a patient, but I don't know if we have time to do that. But the point of this is their lives are terrible. I mean, they're really terrible. The Institute for Health Metrics and Evaluation quantifies the burden of disability and disease, and they do that by doing this massive, like, game theory based survey where they ask all these random people, you know, they present symptoms of 2 different conditions, and they have them say which one would you most not want to have, right? And they do that tens of thousands of times across hundreds of thousands of people, and from that they generate these disability weights, and it's meant to be comparable between any condition. And the disability weight essentially counts for how much of a year of healthy life you lose. So rectovaginal fistula, or a fistula, an unnatural connection between the rectum and the birth canal, has the same disability rating as amputation of both legs with no treatment. So having a rectovaginal fistula is as bad as having your legs cut off and having no one help you, just to give you a sense of how bad it is. But as terrible as this all sounds, there's like really good news. It is absolutely treatable. There's a surgery that was developed in 1850 in New York City on what is now the grounds of the Waldorf Astoria, which is no longer a hotel. It's like condos. And they developed the miracle cure, and women came from all around the world to get treated there, and we still use that surgical mechanism now. And it's cheap, costs a couple £100, and it's really effective. Like 90% of women are successfully treated. It can take as little as 45 minutes. So the problem is, when we talk about fistula, we're advocating for the poorest women in the world, and we're talking about, you know, urine and holes and all kinds of things that people don't want to talk about. So no one talks about fistula, which means that virtually no women actually get this, you know, affordable, you know, cure. So what we say is fistula is important, neglected, and solvable. It's important because the suffering is immense and addressable. It's neglected because essentially there's no resources and no support. The world hasn't worked well to do this. And it's solvable because we know how to do something about it. So what Operation Fistula does is, instead, in many cases, the surgeons who can do this don't have the resources because they don't have the infrastructure to be able to manage, you know, fundraising and grant reporting, which is a lot of paperwork. So instead of giving grants and asking for reports, Operation Fistula flipped the model upside down. And we gave contracts that would pay out direct performance-based grants to individual surgeons when they provide data to us that we can manage and monitor. I was like combining those words, manage and monitor their work. And this is amazing because the surgeons love it. They get the money that goes directly to them. We have more visibility at a patient level than anybody else. So we can really monitor, you know, the outcomes for every single patient. We can identify where there's, you know, where surgical capacity building needs need to be addressed. We can identify causes of fistula. And we did all this pilot with pen and paper. We did it with typing things into Excel. And at the end of it, we realized, oh my gosh, there's so much more we're learning about, you know, about these systems than just what the fistula patient tells us. So that's when we got involved with trying to use technology. But instead of building our own app or coming up with something like that, what we thought is, why not use the best technologies in the world? You know, the companies seem to become a lot more social and a lot more interested, and Tableau is a phenomenal example of this. They gave us product earlier, like early in the process, and then we essentially used the Tableau service corps to identify volunteers who taught us how to use the tools. We then took it to the next level when we met the Tableau Foundation, and they gave us a really big grant. We were the third biggest grant that they'd ever given, and we were by far the smallest organization. They gave us a $1.2 million grant when we had income topping out at about $200,000. So it was like a 6x gift, which nobody does. It was like super bold. And that gift from Tableau gave a lot of confidence to other donors. And I'm really happy to say that through using data visualization and using it to show our work, to manage our work, to advocate on behalf of these women, we're now raising, this year's budget is $1.2 million. And so we in just like a period of about 2.5 years, we've grown 6 times. We've grown into that grant that Tableau did, and that all came from Tableau. And the Tableau community has been super generous with us, helping our team build capacity. And the way it works for us is we have a tablet-based collection system. We use a thing called ComCare, where data is brought in by these surgeons. Then we use Ultrex for ETL, and we build our data warehouse with Exasol. The Exasol team has been amazing as well, helping us deal with some of the hardest challenges of data engineering, which is really hard for a charity to understand how to make these pieces come together. So thank you, Eva, and the Exasol team for that. And then we, of course, connect Tableau to this data warehouse to build these automated workflows. And now we've used this because the technology stack is so awesome, we've used the stack to actually drive collaboration between different organizations in the sector. And as a result of that, we started to see some new things. So, and this is where we come in with what actually is this program. So, and I wish we had our vizzes that we could show you right now, but essentially what we discovered two things that were really just screaming for further analysis and attention. Because what we did in Bangladesh, is all coming around Bangladesh, is we customized our app for the questions that were on paper records in 3 different facilities. And we hired students to essentially digitize those paper records, and then we analyzed the results from each of these facilities. And what we saw in one facility in northern Bangladesh was that 30% of the patients that we treated had their first pregnancy before the age of 15. So they were married and pregnant before the age of 15 years old, right? 30% of the patients treated in this one center. This is like an extreme form of gender-based violence. And so we said, wow, if we have data like this, we can actually show where those hotspots of child marriage or extreme child marriage is happening. We then were able to look, we thought, well, maybe there's more insights here that we can mine. And we looked at 3 different facilities to compare what causes fistula. And in Bangladesh, it's a particularly interesting example because they have an improving health system. So you have more people using it, but the improvement is not keeping pace with the increases in demand. So these patients are the quality of care isn't as high. And so what happens is sometimes a doctor can cause the fistula by making a mistake. And we've seen that, in the country, 34% of the cases are caused by a mistake from the doctor. And in one region, it's 67%. So 2 out of 3 patients in one specific region are getting their fistulas from doctors' mistakes. And that's not to be punitive to the doctors. It's for the government to understand where they need to do very targeted capacity building. And some of this stuff, probably for those of you who work in corporate or in private sector, this is pretty simple stuff. Well, these self-service analytics tools, they just don't exist in our social impact sector. So we thought, why don't we, little Operation Fistula, and all of our friends in the Tableau community, we have a lot of great relationships, and we should try to leverage those relationships and the technology to shine a light on the gender inequality that causes fistula. And so that's why we set up this program. When we talked to Eva about it, she was right on board immediately. And we said, hey, what do you think? Would this work? And she's like, not only will it work, but we can do this and this and this and this and this. And it was just amazing. So I'll hand it off to Eva to add a few words to what is visualized gender equality. And I'm really sorry for going on so long, but I figured there's context. And again, there's no audience to signal to me to stop talking. So.
It's fine, thank you, Seth. And I hope that everyone can sense the passion that Seth has for driving change and ending obstetric fistula for women everywhere, because that's really what convinced me about everything, that I know the team is fully behind this and they will be driving this forward. So with VIS5, which is our shortcut and hashtag for visualized gender equality relating to the Sustainable Development Goal, which is also the logo in the top right corner of the slide, what we want to do is we want to harness the power of data visualization. So when you tell a story with data, there are so many more ideas that come to life than if it was just the team at Operation Fistula and me sitting down thinking about it and visualizing a couple of different versions or perspectives. So you can bring out new stories. We can highlight that gender inequality, but what we want to do essentially at the end of this is, or as the outcome of every monthly challenge, is to fuel that global action, getting more people involved in talking about it, but also making decision makers, making politicians and other organizations aware that something needs to be done, and finding ways to find a really clear path to what actually needs to be done and how does it need to be done. And I think one example of that is what Seth described around their funding model. Rather than giving grants to these people, really paying them in return for data and flipping this completely around and having such great effect with it. And We want to find other ways of just really contributing to the conversation. In some instances, all we might achieve is that more people talk about it. But that makes a big difference because somebody will listen and somebody will then take action. Hopefully there are many more Seth Cochrans out there who are like, I'm going to put my whole life around this and I'm going to drive this forward. So you are amplifying the voices of many of these women who don't have a voice that will be heard. And what's in it for you? As always with Makeover Monday, there's an opportunity to learn. I think with these challenges in particular, there's an opportunity to learn a lot more about topics that many of us are unfamiliar with, we're not affected by. I lead a privileged life, right? I sit here in my IKEA furnished spare bedroom and it's very easy for me to ignore the stuff that happens out there, but I want to learn more. And when I heard about some of these topics, I thought, this is awful stuff. Why have I not heard of it? And I want to make sure that more people hear about it. So we learn about the topics. But as always, you also learn more technical skills around, visualizing data. And then in particular, I imagine that quite a few of these data sets will be survey data. So that's a new challenge because in Makeover Monday, most of the time it's not survey data. So we want to make sure you still get equipped with new skills and, improving your existing skills. We also want to make sure people have fun because as difficult as it is to work with those really challenging topics, if we can get people together, whether it's virtually or in person, you can make connections. Hopefully you can, find some more like-minded people, find some new friends. I've certainly made a lot of friends through Makeover Monday. And even if the topic is difficult, you can still enjoy the process of working with the data, finding insights, sharing it, and also getting attention on your viz because people will find it insightful and helpful. And then, of course, the impact that you can have and behind the scenes. So Helen and Seth, but also my colleagues and I were working to make sure that this is really amplified, that we're talking to journalists to tell this story, that we get more eyes on this cause. And as much as possible, we would promote the work that you have put in so that that can be seen more broadly as well. And then how it works? Well, most of you are familiar with the normal Makeover Monday process. We're going to have 12 data sets over 12 months. So once every month in one of my weeks, we will have the visualized gender equality topic. And we have picked those dates in advance. It's going to get on the calendar, closer to the time. And we're expecting over 1,000 participants for those weeks. So we will track that based on the existing Makeover Monday tracker. And Helen, Seth, I'll hand back to you to start us off in those topics.
Absolutely. So the reality is there's a lot of different dimensions of gender inequality, and we have kind of selected some of the most extreme versions that affect the poorest people on the planet. And we've sourced this list, and this is a part of the list. We've built a list of about 18 topics that have to do with different thought leaders who they usually come in groups of 12. There was a large women's conference in Beijing. I think we're celebrating the 30-year anniversary this year. We sourced some of it from that. We've also sourced from Women Deliver, a global advocacy organization focused on gender equality. And Melinda Gates has written a book called The Moment of Lift, which I thought was excellent. And it essentially goes through these different issues. So 12 of the issues also come from her book. Again, it was a much better book than I thought it was going to be. So I recommend anyone. I bought a copy for everybody on our team. So it's excellent. In any case, the topics that we're looking at are access to sexual and reproductive health, maternal health, which is completely a lot of maternal death that's all preventable from very cheap interventions. Of course, obstetric fistula, which is our mission. Child marriage, which is really nice way to say a really terrible thing. Access to education. There are certainly disparities between access to education for girls and boys. Child mothers, like the issue in Bangladesh, we know there's examples where women are they're not women, they're very young girls are having babies, not just as outliers, but as the cultural standards. There's gender-based violence, which takes many different forms. It's not just like domestic abuse. There's There's a variety of different types of gender-based violence. Female genital mutilation is one of those mechanisms. This is horrific. Unpaid work, also like a lot of women do a lot of work. I read a quote, I wish I could remember, I won't do it justice, but essentially there's a huge amount of work that's done by women that is not recognized by anyone, not recognized as economic output, but it's essential to the function of society. And so this is a theme that we would really like to explore. And this is obviously something that cuts across, you know, our worlds as well. Economic empowerment, the variations between people's different access to economic opportunities. Women in power is about women in decision-making or in government, essentially, like how much representation do we have to try to represent, you know, half the sky, if you will, or half the population. Period poverty, we know that girls' menstruation keeps them from accessing a really critical part of their adolescent transition into adulthood. And that keeps them out of the education that sometimes causes abuse to focus on them. And then, of course, women in the environment. We know that climate change disproportionately affects the poor and poor women. And so we're going to be looking at all these and more. And the way we're doing this is we are looking first. Do you want to talk about this?
No.
I'm sorry. I know I'm kind of ranting. Helen's really knows a ton about this. But why don't I start and you can carry it forward? But we're looking for data sets and for partners. So we think we can source this from two directions. So we know a great organization that works on, you know, child marriage, and like we can talk to them and say, hey, do you have any data? Or like, what story do you want to tell? Particularly for sub-national issues. So we don't want to do some global comparison stuff. What we want to do is focus on an area where all this capacity for data visualization can move a government to change a policy. Okay, so we might work with some large organizations, but we really want to focus that work on sub-national impact, because we kind of think of a laser beam. We focus the laser beam on this one spot, right? We can make something happen. But we're also looking where there's great data that could be used to move the needle, what organizations might be able to pick up the visualizations that we produce. And this thing that we're doing now, this week, is an example of that.
Yeah, our launch data set was a really good example of that kind of data. And, you know, the story that data set told was, you know, shocking and disturbing in so many ways, but it also really shared with the Makeover Monday community and the Viz5 community the interconnectedness of vulnerability and inequality faced by women in their day-to-day lives. Not only did it expose these deeply troubling attitudes and behaviors of domestic abuse and violence against women, but it also showed the interconnections in things like access to education, environment where women were living, wealth quintile, you know, the economic empowerment level of these women. And so as a launch data set, as a way of really sharing the intention of the project and what we're trying to do, we felt that it really told the story of just how extremely complex and interconnected so many of the barriers to achieving a gender equal world are. And so we wanted to share that story with the Tableau community with our launch data. But as Seth said, we're also really focused on trying to get some country-specific subnational data so that we can start doing really focused advocacy efforts for specific countries. So now I think all that's left for us to do is talk about how you guys can get involved. There's a bunch of ways. So as Seth said at the beginning, please join our community at viz5.org. Please share this with your communities. You know, we have people from all over the world on this call. If people sign up to viz5.org, there's no commitment, but it does mean that we can keep in touch with people beyond just Twitter. We're going to be trying to share updates. That's everything from links to when we publish data, to if we get articles published by journalists, to if we get, you know, an advocacy partner have something exciting happening. And this is really going to be the way we keep in touch with the community. Obviously, there's also taking part in Makeover Monday and Viz5 on the weeks when we have those data sets published. Take part in Makeover Monday anyway, because it's completely awesome. And then, of course, just use your advocacy, use your voices. Share materials with colleagues, friends, with the community, share things on Twitter and LinkedIn. You know, so much of this is a public campaign, right? We really want to make some noise around this and get people excited, and also share the power that these visual analytics tools can have for social impact movements. And we also are really keen that you guys reach out to us, you know, reach out to Seth and myself, reach out to Eva, keep in touch with us with insights and ideas. If you want to host events, we have all kinds of resources that we've developed, and we would love for you to get really involved with this project. So I'm gonna end with another shameless plug with viz5.org, and also please do follow us on Twitter.
And can I just please make a direct appeal? And like, I hate to sound like a telethon, which I kind of feel like we're doing now, right? But we almost have all 50 states in America. Like we are missing 4 states. We have individuals from every state except New Mexico, Wyoming, South Dakota, and West Virginia. So if you know anybody who knows anybody in any of these states, please have them go to viz5.org, because we really want to color all of America. And we're so, so close. And just to say, like this already through this call, we've had 9 people sign up to viz5.org. So we're like watching them come in. So please, if you know anybody in New Mexico, Wyoming, South Dakota, West Virginia, please
help us out. I'm gonna stop sharing my screen now and hand over to Eva.
Thank you. And thank you for that background information. I think that's really helpful for people. What we're moving over to now is the active part. So please stay on the line and join us. Typically what we do with a Makeover Monday Live is we get everyone sitting at tables, either working by themselves or in a pair or in a group, to visualize the data that we have. Now, we can't really do that for an hour because you're wherever you are, like looking at the screen. But we didn't want to fully drop the interactive element or the viz building element. So we said, let's limit it to exactly 25 minutes. So if you have not built the viz yet, use those 25 minutes to build whatever you can build in 25 minutes. It doesn't need to be polished or perfect. It's just a starting point. If you already have built your viz, but you might want to change something based on the information you've just heard, use this time to do that. Alternatively, if you want to be hands-off, I will build something just kind of ad hoc. So you're welcome to watch that. You're welcome to also mute me and maybe put on some tunes and just kind of watch it happen. And what I would love for all of you to do, if you have participated already in Makeover Monday, you've built a viz, share in the chat or the Q&A the link to your viz, because what we want to do in the last 15 minutes of this call, so in about half an hour, is we want to then share what people have created. Typically in a live event, we get people up on stage, we get them to talk through their viz. Bit difficult now, and we can't unmute you, but we can put your viz on the screen and actually just give a quick first impression. We're not going to go into a detailed review. I would rather just show a lot of stuff from different people. The idea being sharing all these different perspectives. So with that, instead of music, you're now going to get me for the next 25 minutes, or you build your own thing. So I'm also happy for Helen, Seth, Pablo to comment.
Sorry, Eva, I just got to add something. We are recording this session, so it will be available to watch on demand later on. And if you want your visualization to be presented later on, please put the link on the Q&A box, please. Okay. It's easier and better to track them down. Right? Okay. Otherwise, it gets lost in the chat.
Okay, so please put that link in the Q&A, and then I will bring it up. And to start my vizzing, I will need glasses. I will need to look a bit more intelligent and also actually see what's happening on the screen. And if you have any questions throughout, please just post it in the Q&A or post it in the chat and let us know what your question is. Otherwise, I'm going to explore this data. I've already built my viz earlier this week. So my viz was about looking at how education changes the attitudes towards violence towards women. And I think there's, a viz is never done. So I thought, why don't I use this time to actually explore something else? And for those who want to get a bit more of an understanding of what the data set is all about, I just start by kind of clicking on things, right? So I double click and I double click again. This is how I use Tableau. And then I see kind of what happens. So we've got survey year, we've got a bunch of different survey years, and then we have a value field. I mean, this essentially is just a table, but we have percentage values. So, okay, so there's something else going on in there. I need to also have my gender somewhere in the view. Okay, male and female, and then there's a question. Okay, I'm just trying to make sense of what's actually happening. So if I look at age as a demographic, I have 3 different age groups, and each of them is split into female and male. And then we've got our survey years, but also then, of course, we have the different countries in there. So let me clean up a bit. I mean, I could just start from scratch, I suppose. But let's go back to the survey question and the survey response. So, demographics question, demographics response. We have the different age groups, which also means, you know, people below 15 or above 49 were not included in the survey. So what does that mean for the story that we're trying to tell? We have something around education, we have employment, marital status, and residence. From the original viz, which you can find in case you don't, you're not aware, if you go to participate and then data sets on the Makeover Monday website, you will see week 10, and you can go to data.world where everything is stored. And here is the original viz. We can also bring that up in Tableau Public. And this is totally unscripted, so I don't know if I'm going to have a viz by the end of this, but we'll see. We can do that together. So this is the original viz, and it tells me that education makes a difference in changing attitudes, but it also differentiates between men and women. So men being purple, women being purple, men being gray. So I use that as a bit of an input for my own viz building. And maybe what I am interested in is actually looking at the gender. And let's just get rid of that again. Now I want my value. And of course, this is just summing up all the percentages, so let's not worry about that just yet. Let's bring in country as a detail. And I actually want to change this to a line. And this now shows me just the difference in the percentages for each country between females and males. And we see there's quite a lot of downward sloping lines. The percentages are still a mess, so we need to, of course, bring in our question response. But I might just filter. I might just pick, actually, let's do that differently. Let's show the filter, and I'll bring it over here, and use a radio button. So I can select one at a time. Okay. I need to see this. Okay, if the woman argues with him, then violence might be justified. Who has those opinions? Let's get rid of those nulls. And also, okay, so we have, so that's the question, but we also want to bring in our demographics. So maybe I'll put that on rows. Maybe I'll just keep age and then replace that with the response. Because what I want to see, and I'm actually going to put that here, is I think it's getting better with age. Like, one thing I'm curious about is, are the attitudes different the older people get? So maybe young people, they're still quite influenced by, you know, their parents' opinion or their peers' opinion, but as people get older, they reject this notion that violence might be justified. Now, there's an interesting country, Azerbaijan. There seems to be, is it the same everywhere? Azerbaijan? Oops. And Azerbaijan, yeah. So there seems to be the opposite. It's not the downward slope, it's the upward slope. So more males do think that violence might be justified in the situation where she argues with him. And if she burns the food, okay, there's a lot of rejection of that. If she goes out without telling him. Okay, so I'm trying to just make sense of this for myself. And what I found in my previous exploration is something interesting for South Africa. And let's pick just South Africa. In South Africa, it's one of the, if we go back, so many countries have a downward slope. There are a few that have an upward slope, but South Africa seems to be one of those that has an upward slope. And while the overall percentage is much lower than in many of the other countries, I actually thought it was interesting because, to me, out of all those countries, and especially in Africa, I would have expected South Africa to, well, be different. well, I don't know if I expected that, but I just, you know, for me, this one stood out. And there's a clear change with age, right? In the, I mean, we're going from 13.5% to 7.5 to 5.7. So you can clearly see this flatten out, which means the difference between genders in opinions is changing, but also overall there is more of a rejection. But for females, it doesn't change all that much. 6.4 down to 5.1, up, oh, same, 5.1 again. So I found that quite interesting. I need a bit of audience engagement. Do we have any questions? Because this is becoming a bit of a monologue. Now, if we just go by country, we see that spread, and Helen mentioned that this is the low and middle income countries. We had some comments on Twitter that, you know, it's skewed because the data doesn't include all countries, and we're conscious of that, but we can't change the data source and where the responses came from. This survey was specifically done with low and middle income countries, which is why the selection is what it is. You'll also see, if we go, I think, so Seth made the comment about the gaps in the data, and I think that's a really valid point, and I saw a few visualizations that actually made that quite visible. So if we look at, maybe let's go that way. Well, we also need the gender in there. And the actual question. Maybe let's pop that there as well. It's gonna get a bit messy. And I want to filter the null values out. Here we go. Okay, so we see some gaps if we filter the null values out, and this, oh, we haven't included country yet. Oh, that's going to be quite messy. Well, we see that there's going to be gaps with the years. Let's be adventurous and put the country on columns. You'll also see among the countries that for some we don't have any responses from men. That is true for, you know, a number of different countries, but also just a number of different responses. And what we would also see is that for some countries, there's only data for 1 year, or it's, you know, but it's also not complete. So being aware of the gaps in the data is a tricky one for this data set, because you can't just make broad sweeping statements, because we do have those gaps. Okay, let's build something else. So I created some regions based on, oh, let's put the country in as well, and put the regions on color. So I've created some regions just for my own benefit to, well, and I clearly didn't even name all of them, but just so that I could maybe use that as a filter to see, you know, if I have a certain hypothesis, does it stand, is it different in different regions or not? So I would recommend to always just, I mean, what I did at first, I'd probably build 5 or 6 different charts, just looking at the different fields, because my first start was I actually created the original viz based on the very original, but this viz was just a cosmetic makeover. I wasn't really going deep into the data. And then when I opened up Tableau on Monday, well, I think it was Sunday, and I started working with it, I realized how difficult it was. So my hat goes off to everyone who's participating this week. How are we going for time? Okay, about 15 minutes, just under 15 minutes in. I do want to check, because I don't know if I can see the chat while we're, oh, I can see the chat, but I don't see any comments yet from people.
I'm following the chat and I'm following the Q&A, so there's nothing yet.
Okay.
All right. But
okay.
We're still here, Eva.
Good, excellent. Well, I do know that some people have participated, so if no one sends any links through, then we can just go through Twitter and we can find stuff there.
Brilliant.
So that will not be a problem. I'm just trying to think what else I could go with, because the story about South Africa, I just don't really know how to frame it wherever I had it here, because again, also the survey, the sample size, I think somebody told me what the sample size was, but even so, I can't, generalize across a whole nation. You also don't know, well, we do know whether these people were, well, we can change this to residents and have a look. Rural and urban, but that's even, so, okay, so that's maybe as expected, that we think that in rural areas which tend to be more conservative, that we see a higher percentage of people agreeing that violence might be justified compared to urban areas. But I wonder how then the cross-section would be. So if you combine rural and age, which we can't here, but if you were able to combine that, that would be great. Just to see, which one is the heavier influence. Okay, so I want to go back to gender and country. Let's swap that around. I don't know why I started this way, but let's have a look. Okay, there's some questions or comments coming in. Okay, some person said, in the original verse, I saw the female and male comparison. How have we dealt with the missing values of men? Because otherwise the comparison might not be valid. So let's jump back to the original so we can look at that in context. So basically, I mean, aggregating it at this level is not correct, but if we went down to an individual country level, so Eritrea, for example, we don't have male responses. Let's try and find one where we have both responses. So in Chad, we have a response for this question of, I think education was selected. No, okay. Oh yeah, it was residents, but we have responses, and I would recommend to not aggregate this out for that reason, because you don't want to have skewed results that don't actually represent how it really is. Whereas if we go down to the individual country level, and from my going through the data, I found that there were, let's test this out quickly, there didn't seem to be multiple years for each country. So in every country, I seem to be getting just a single year. So we don't have to worry about that so much, but we should go down to the individual country level to see the right results for the different indicators. So using the employment to make sure it's all filtered down, because otherwise we're going to averages across sample sizes and across different countries. That just isn't representative. So with the original, you are allowed to critique not just the visual, but also, of course, how data is being approached, how the analysis is done. So I would also recommend doing that. And here, if we look at all the nations in Africa that were included in the survey, we get those aggregated values. Okay. Okay. Any other questions? Great. I think Pablo has handled a lot of those.
Yeah, there were a couple of questions that I replied already. We have a couple of visualizations to see, and I'm just copying the links so we can have a look at them in a few minutes.
Yeah. Excellent. Okay, good. So I'm just going to kind of keep tinkering. I'm going to get rid of the survey year, mainly because if I just have a single survey year, I'm not worried that I might aggregate something incorrectly. If I had, multiple survey years listed, then I'd be including that for the level of detail. So I do kind of like the slope chart idea. So let me try that again. Oh yeah, and now we need to, of course, bring in all these other indicators. And maybe, no pressure. Okay, I'm going to bring all the filters to the left just so that I have it all kind of in one place. Again, let's make this a radio button. Show that filter as well. Well, I guess we don't really need that. That's just going to be, no, we do need it. We do need it. Okay. I call this the iterative process because clearly there is no set structure. I only want the relevant values. And so we've got our country, our gender, and now we need the question as well. And the question could probably go there. Yeah. Do we now have the right level? Yes. Okay. So now we're good, but we have, we have this like crazy amount of countries. So what I might do now is to also add my regions filter, because then I can look at different regions all at once, where there might be some cultural similarities. At least they might be more similar than countries in a completely different region. And let's go away from Africa and maybe look at Asia. We have fewer countries. That's too wide. I knew that was going to happen. And maybe we just do a swapsy, and we still want that to be the, oh no, what did I just do? Question, female, male. No, that's not going to work. Let's leave it this way. So we have a few countries that have very high response rates in terms of being supportive of, there is a justification for violence, but then we also have lower ones. What I like is that Tableau, fixes the axes automatically, so we don't get any skewed results there. And what do we have? So we have some, so in the Maldives, we don't have answers to a couple of the questions, which is okay. And then Philippines and Tajikistan, we don't have answers from men, but also Turkmenistan. So I might just exclude those. Maybe also there's another one, Bangladesh. So now it gets a bit more compact. Okay, that might be a bit better. Okay, so this is interesting, and you see a few things kind of pop up. So is this Kyrgyzstan? Not sure, but you see that for some responses it's actually quite a high rate. Whereas, so if she burns the food, people don't seem to think that is a justification for violence. It's quite a low response rate. But then for at least one specific reason, which is probably, if she neglects children, the response rate is much higher. And then we see in Timor-Leste, there's the downward slope. So male support for this idea that violence might be justified is lower. I know it sounds a bit clunky when I always say support for thinking that violence might be justified, but I haven't really figured out another way to say it, because I've seen different titles or claims in some of the visits this week, and some of them just weren't really right. Oh my God, you can't even see me. Here we go, glasses off, because there's so much reflection. But if people say, people think that the wife deserves to be beaten, that's not actually what this says. It just says that in these situations, these column situations, violence might be justified. That doesn't necessarily mean that the people who responded with yes actually do it, but it also doesn't mean that a woman deserves it. It might just be, it's fine. It's a fine difference, but I think it really matters, especially with these topics and the way we communicate our findings, and also opinions or biases that are baked into it. So, I mean, I wouldn't publish it like this, but I find this quite interesting just because I can see a couple of different things pop out to me. If I now, I get rid of the country filter, and maybe we go to the Middle East, we have more male support for that idea that violence might be justified. So that's with this upward slope from female to male. I wonder if we look at Eastern Europe, that also seems to be generally the trend, but there's huge differences. So look at Moldova, where we've got, for at least one specific reason, again, I think this is the child neglect thing, but then for others, it's a lot lower. And yeah, so what I typically do, and there won't be enough time now, but I typically then try and pick one of these interesting data points and then build a story around that. For me, the reason I created the viz that I did this week is because I'm just kind of getting into these topics and I don't really want to do stuff wrong or communicate the wrong results. So I took the inspiration from the original saying, education makes a big difference. And I thought, what can I do to really visualize that shift that comes with more and more education. So I went from no education to primary to secondary to higher, and hopefully it's very obvious that this red line, it really shifts the attitudes to the left, which means less endorsement of the idea that violence is justified. And I put in a median line just to also support that more visually as well, because even if the dots are spread out, which can hinder us from, or can keep us from really seeing that shift, the line moving to the left should be rather obvious. And I also think this is a topic where more text is probably to be expected, because we need a few more words to explain what we're trying to say. Typically my vises are a title and a short subtitle, but I've gone for a second row or a second section just to really explain what the viz shows. And then using the tooltip to include a plain English sentence that says, okay, so in Chad, 60.1% of female survey respondents with higher, oh, why doesn't it say education? Well, that's really embarrassing. I better fix that. With higher education, considered it okay to beat a woman for at least one specific reason. So I think, yeah, let's go back to plain English language to really get that point across. We're now at about 10 past. Do we have any more questions, Pablo? Anything that I've missed?
No, we don't. We have 3 visualizations. I can send them to you. So if you want to
Yes,
them, and we can see them online.
I shall do that. I think we will move on from here. Hopefully it was a bit, interesting, or maybe you picked even like a little shortcut up from what I showed on the screen. And just taking you a bit through my thought process of how I approach it is, typically it's very much, okay, I look at the data in the data source window. I just want to see the value, see what I'm actually dealing with. I skipped it this time just because I had prior knowledge, but going through building different charts and just seeing if something stands out, especially when I'm unfamiliar with the topic. Okay, without further ado.
If you look at the chat, the chat box, I just sent you a private message with the links.
Okay, so we'll start with Michelle. And I kind of I want to always high five Michelle from afar, because she's such a consistent participant. She always dials into Viz review and submits her Viz. And it's really helpful to have this consistency and these champions in the community. I really appreciate it, because I can see the progress, and when someone sticks around, it's easier for me to see that progress. We gave Michelle feedback yesterday, so actually Helen and Seth and their new colleague Will, they joined Viz Review, and Seth and I discussed the Vizes. I focused more on the data visualization aspects, and Seth gave me a lot of really helpful input on the messaging and how things come across, what's the impact or the first impression on the audience from his perspective. And we gave Michelle some feedback, which she has implemented. So that's great to see. Thank you, Michelle. And she's also focused on that education aspect, looking at, how do things improve? And again, we see this significant drop across all of the different reasons why someone could, be violent towards their wife. And for all of them, the more educated people are, the less likely they are to say, yes, violence is justified. Let me just remove my little panel. So in the top right corner, I also really liked how she's included that how to read chart. And when you scroll further down, it's repeated because, well, it's really helpful, but because it's a long verse, you might forget, oh, how was this actually laid out? So this is Michelle's verse. I like the minimal colors, but then also the call out at the bottom to gender equality and the inclusion of different quotes to show that this is not just a topic that we're tackling at Makeover Monday this 1 week in March 2020, but rather this is something a lot of people are actually concerned about. So thank you, Michelle, for submitting that link. Oh, funky thing going on. So now okay. Oh, here we go. So the next one, we have Neil Richards, and Neil is one of those champions. And for me personally, but also I think for us more generally as women in the data industry and in technology, whether we tackle those topics or talk about just anything else, having male allies is great. So I appreciate, Neil, that you're participating, that you're supportive of this, that you've dialed in. And I briefly looked at this viz ahead of time when I saw it pop up on Twitter. So is violence against women ever justified? I think a very appropriate and thoughtful title, because if you try to be kind of too catchy with it, it can become insensitive very quickly. So I appreciate how that's done. And this is very visual, very data art, which also, with a topic like that, I actually think there's a really good place for it, because some people might be, I don't know, like showing them the facts straight up might be like, oh, very in your face. But having some people just explore a visualization to kind of gradually understand what it's telling them can be really helpful. I really like that breakdown choice filter on the right side, because, or parameter, because it's very easy to understand, okay, what's the age, what's the education? Let's go to no education. Oh, did this change? I need to, I'm just going to train my eyes on the screen. Yes, okay, it does change. And I love that, you know, the petals, I guess, is it petals? What would you describe this as? Or the starburst thing? It grows, so you can see, okay, people have more views in support of violence, but then with increasing education, these should all be shrinking. And they do. So I love that. And I wonder, Neil, if animations are possible for this type of chart. That would be really cool to see that kind of dynamically, and you could even animate it and share a GIF. So yeah, I think this is, the color choices are great, and this is a very, it's a very different way to approach it, but also it shows all the countries at once, and you know, everything updates dynamically. So we've got the callouts for the different selections that we've made. Okay, and then we have Simon Rowe. Now I'm curious if I've met Simon, because that name sounds very familiar, but I'm also sometimes a bit useless remembering people's names in the situations where we've met. So let me put this in full screen mode as well for everyone. So, oh, is that the title? Oh, okay, it is the title. I wasn't sure whether I'm cutting off a title. Percentage of people surveyed in the relevant group who agree with at least one specific reason of. Okay, so there's different questions listed out. And I think, so this one, you know, the colors are very striking, and we see that I think, so he sorted it by, it should be by the value field, right? I think, okay, average, okay, by the average female response. So he's broken that out. Okay, yeah, and then the male one kind of corresponds to that. And education, I mean, even if you were to just single out education, just see how much of a difference it makes, because we go from really dark purple to a much lighter color. Like it's such a stark contrast. You really see that across all of those different factors, higher education is the biggest difference. At least visually, that's my perception. So thank you, Simon, for creating that viz and yeah, playing along with the data. I think that's a really, really cool viz. Okay, Pablo, do we have any more that people wanted to share?
No, we don't have any more. So if you probably would like to go on to some of the hashtag visualizations that we had in this week.
Yes,
that'll
I can
be great.
do that.
Just to probably, we can show a couple more, perhaps.
Yeah, definitely. And what I might do is search hashtag #Viz5. That might be a bit faster than the searching the Makeover Monday hashtag. So, okay, some people don't post photos, so let's not filter it down to photos. Oh, hang on, latest, not to top. Because we also had, oh, where was it? So, okay, there's a lot. I can't use TweetDeck because on TweetDeck I have a column for my favorites this week and I don't want to give anything away. Okay, so Jonathan Donnell has participated. He says feedback welcome. We won't give him feedback, but I think that's a good enough hashtag for us to know that we can you know, show it. So this was us yesterday working on this review. And how about Calvin Tang as well? And of course, Maria, because I know she's on the call, I do want to congratulate her on her Viz of the day, and also bring up her Viz, because I know that Seth in particular really liked how it showed the gaps in the data. So let's start with Maria's Viz. And how do I wanted to go to the Viz so I can put it in full screen mode, but anyhow, we'll go with it for now. And please, Seth, if you have any comments on any of these, or Helen, then please jump in. But I know when we spoke yesterday, what he liked was you can see the world map really faint in the background, but because only the countries that I included are highlighted, it also shows the gaps in the data. And when I say gaps, I mean, I don't know if the DHS would actually call it a gap, because they said we're just looking at lower and middle income countries. But for us, when we want to ideally have all the perspectives across the globe so we can compare, we perceive them as gaps.
Yeah, that's what I like about this the most, is that it really spoke to the missing data in a very subtle but yet really clear way. And I also like there's it almost feels like there's a haze over it, you know, like we have to get clarity, so it makes you want to look a little more closely. And I don't know if that's the colors that have been used, but I really, it's an excellent Viz. It's really, yeah, really clear. Great use of color, great use of contrast. Saying a lot of things with the images. I can see why this was Viz of the Day. It's really good, great work.
Yeah, and it's very clean. I really like Maria's style. You know, it focuses on certain things rather than trying to do everything. And I think we're always tempted to, okay, let's look at everything because we have all this data and we want to visualize everything. But especially for Makeover Monday, where we encourage people to, you know, don't spend hours. I would rather people spend half an hour every week than 2 hours once a month, because if you do it every week for half an hour with a different data set, you'll get more practice and you'll probably learn more. So it's really helpful to do something that's focused, and her focus was, let's look at age and how perceptions change as people get older, but also let's look at education. And again, the story of higher education, but also secondary education, making such a dent into people's attitudes towards violence. I find that really, really good. So well done, Maria. And then Kelvin, so let's make that a bit larger. I hope you can all still see my screen quite well. Education makes the most difference for changing attitudes on violence against women. So he's done this, well, it's a jitter kind of dot plot, I'm not sure what, so it must be randomly jittered sideways. And then vertically, it just depends on where people sit. So what we expect and what we do see is a shift from, you know, kind of a taller Viz or a taller jitter on the left to going much flatter on the right side. And we have, I think every dot is a country. Yes. Okay. And these are just women's responses, I believe. Oh, sorry, women at the top, men at the bottom. Yeah. I think the one thing that I would rethink here is just if because I think the shape is not as clear, because, you know, we have this now spread out wide on the right side because they're all so low. And that then makes me think, oh, how do I interpret the width, which doesn't actually have any meaning. But I really like the colors here and just how simple it is, and showing all the countries at once as well.
Yeah, I like this. I like this one too, because you can see it's like that line of equality, you know, merging towards coming down and going from dark to light, you know, like as education. I think that's like a great theme, enlightenment. But seeing the things merge towards that line of unacceptance, I think is really good. And yeah. I can't see well enough, but are the two things on the same scale?
Yes, so basically the top row is female and the bottom row is male responses.
Yeah.
And they're both scaled the same, yeah.
So that, I think, yeah, I really like this one. I like the style of it, the colors, and yeah, just the overall look and feel of it.
Yeah. All right, and let's pick, so the last one is, I just messed up. Yes, let's reset the view. So this is Jonathan Donnell. and he's really incorporated that Viz 5 color, and also his map shows all the gaps. And I think it's really helpful, especially if you use a map, for us to then see, oh, there are only these countries included, because it immediately visually excludes the other countries by graying them out and making them really part of the background. And then the other Viz is a simple bar chart. And I think there might be some averaging going on, but also in terms of the approach, having those nice large numbers, a nice, fairly simple, a simple bar chart with prominent color, and then that map is a good approach just to get some facts on there, show some comparisons, show some location, and having the context around, descriptions. How is violence against women and girls described by the UN, and then also, well, a call to action, learning more about visualized gender equality. Okay, so with that, this somewhat different style Tableau user group, let me just stop the screen share for now and go back to people's.
It's a bit of a challenge to do this user group, virtual user group with participation.
Make a quick announcement. We have, during this meeting, we've had 13 new people sign up to viz5.org, which is amazing, because we are now at 596. So we're 4 shy of 600. And Stephen Skinner, people in West Virginia and New Mexico, please email them, because it'd be great to break 600 with the 4 states. So,
yes, it would be amazing.
Yes, absolutely. And I think also I would rather do this, how we've done it now, and just roll with it and try a different approach. And by all means, give us feedback, tell us what we could do differently next time, because I'm sure it wasn't the last one we did. But I really love that we had people from the US starting in as well. I know that there's a huge Makeover Monday community in the US. It's our largest market, and I'm glad that you were able to participate. I think we would have had a very low turnout had we done this in person in London at the moment. The city is pretty deserted. It's pretty empty behind Tableau.
This is a new model. I'm telling you, this is how the world is going to work, at least for the next 6 months or so. And so, while Eva was going through, showing how to build the Viz out, there was a tweet from a Tableau user group in Omaha, Nebraska, saying they're looking for ideas to do virtual events. And so, if you are out there in that 28% of people who are all around the world, presumably in the United States, if you have Tableau user groups local to you and you think this would be a cool thing to do virtually, we would love to do that. So please get in touch. You can email or tweet Operation Fistula, me, it's at Seth Cochran, or Try My Data, Eva, and we will love to do this with you. So this has been a great experience for us, and I hopefully for everyone else too.
Thank you, Seth. And I wanted to add to that we have a package for Tableau user group leaders that includes an event template of how can you run this? It was meant to be in person, but we can change that up and give a virtual option, but also a slide deck that people can use to run through how Makeover Monday works and, the Viz 5 details. So if you want any of that, or if your user group leaders want that, we have that available. We've shared it on Tableau's Slack channel for user group leaders, but if you need access, by all means, let us know. We would love to see people doing events. And the good thing about virtual is, as long as we're awake, we can always dial in. We can't get on a plane, but we can always dial in and say hello and, facilitate a session.
Absolutely. And also, if people want to know more about Makeover Monday, they can go to the website where they have plenty of information there as well.
Absolutely. So, with that, I think we're going to close out. For us here in London, it's going to be dinner time. And for the people in the US, I hope that you all have a good day at work, whether you're sitting in your spare room, in your kitchen, at your kitchen table, or in the office. And we would love to see you participate and share the message more widely as well.
Thank you so much, everyone, for joining in. Helen, Seth, Eva, thank you so much for being with us. We don't know yet what's going to happen or when we are going to have the next Tableau user group. As Seth was saying, this is probably the new way we're going to do user groups. So stay tuned. We are going to let you know as soon as we have news, when and how, what's going to happen in the future. We have recorded this session, and stay tuned on LinkedIn, on Twitter as well. We are going to post the link probably tomorrow, hopefully, and with a link so you can watch on demand once again. And thank you so much for being here, participating.
Thanks, everyone.
Thank you so much, everyone. This has been wonderful.
Take care. Thanks. Bye.
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 Bye.